1 in 5 Canadians experience mental health issues, and chances are you or someone you know will suffer from a mental health concern this year. Today, which we are in the middle of Mental Health Awareness Week, we are joined by Sam Duboc and Dr. Amaria from Beacon and CBT Associates to discuss how to recognize mental health symptoms and offer options for adolescents and adults who are struggling. Thank you very much both for joining me this morning. We are in an incredible time when it comes to mental health. We're talking about it. It's far more open about it, yet we are still missing signs and not getting help to people who need it. How do we reach those people? What do we look for in friends and family who may be suffering from mental health issues?
So, I got into this business because of depression I went through. And when I was going through it, I was tired all the time. I didn't want to get out of bed. I withdrew from society. I sort of didn't want to go out with friends. I was anxious. My family would notice my temper would rise very quickly. It was all of these things. Sleep had gone away. I was up in the middle of the night pacing. And those are very common symptoms for people that are suffering from these afflictions.
And is it the same for kids as well as adults? Do we see similar symptoms?
Absolutely. For adolescents, young adults, you'll see very similar symptoms. There may be a lot of withdrawal, actually, from life, just as Sam sort of pointed out, as well as behavior that seems out of the normal for that young person. And so if an individual is withdrawing from friends or spending more time with activities that they haven't engaged in before, those are the things you're going to watch out for.
And what do you do to try and reach them? I mean, everybody says, well, you just got to go get help yourself, if you see that. But it's not that easy, is it?
It's not.
No, it's not that easy. You really got to, first of all, if you're in crisis, Roger, you got to call the crisis hotlines, go to the emergency room, dial 911. Toronto.ca has a full list of crisis centers here in Toronto, which you can access. But if you're not in crisis, it starts with going to a registered healthcare professional where you can get a full assessment. And if you can't access those, and they're hard to access in our area, then go to a digital platform like Beacon, where it goes through a very rigorous assessment and helps you understand exactly what's afflicting you, and then gives you ideas and ideas where you get help or what types of help to get, whether they be medications or therapy or others.
And what do you do, though, as a friend or family to try and guide them towards that? Because I imagine if you try and push them towards something like that, you'll get resistance. How do you help as a friend or family?
I think it's all sorts of things. You talk to people about the destigmatization. We really say, these are things that people feel normally. But when they don't feel like when you don't feel like yourself, that's when it's time to really try and get help. So using a supported loved one to, explore a digital platform, to go to the family doctor, it's the first line of treatment. We are fortunate that there is a lot of information out there, but reminding people that there's help out there. I think that's what really guides people to move forward.
And one of the things that a lot of people are working with, CBT, cognitive behavior therapy. Talk a little bit about that.
Yeah, so, there's help comes in a lot of different ways. And for some people, it's medications that are required, and you can go to your family doctor to start with that. But CBT is really one of our best and most well-established therapies, or psychological therapies that are out there. And it involves usually a structured, guided protocol where a mental health professional is leading you through the skill development. I can tell you a bit more about what a CBT actually involves. Everything from learning a new way to think, because we really believe your emotions and your behaviors are caused by your thoughts.
And Sam, it helped you, did it not?
Yeah, absolutely helped me. It really helped me, as Kush said, it helped me figure out how, when I was thinking this way or doing that, how to pull back and how to say and test it and really think about it. Is that true? Is that not true? It's really a structured learning approach that builds resilience over time, and it stays with you. So I still use the skills 6-7 years later that I learned back in those days. They're still with me, whereas the drugs, once you go off, they're not necessarily with you anymore.
What is it that you do that makes you pull back and think about it? Is there something you say to yourself, or?
Yeah, I basically stop and challenge myself.
Yeah.
So why are you thinking this? What is causing you? You don't return my call, Roger. Well, is it because of me? Did I do something? Am I a bad person? Which, when you're depressed, you think everything's because you're a bad person, you're not worthy, for example, one of the symptoms. Or is it because, hey, maybe you're busy? Maybe you've just got something going on. Maybe it has nothing to do with me, which allows you to stop that negative spiral.
And so what Sam's really doing is he's actually testing his beliefs. He's looking for evidence that his beliefs may be true. He's looking for more balanced thinking. And CBT really is about developing balanced thoughts, realistic thoughts, and testing it out as he did. We call those experiments, right, to learn new ways to think.
Okay, thank you very much both for coming in this morning. We appreciate it.
Thank you.
For more info, head to breakfasttelevision.ca.